Boy, it's getting hard, isn't it? How are you all doing? Are you managing to survive the grinding, as it were? This is just really starting to wear down on everybody, and I get that. I truly do. And because I'm right in there with you. I'm right in there with everybody. So hello. This is Dr. Chris Martinson. I'm here with your SARS-CoV-2 daily update, Friday, April 17th, 2020, day 85. What can I tell you? This is... We're just getting started. I know this is day 85. It feels like a blur. It feels both longer and shorter than that, but here we are. And it's going to be a long time before this resolves. And so the real key to getting ahead, the real key to thriving and not just surviving this whole period is going to be the extent to which you can get out of your current mental framework, if that has you rooted in the past, and moving into this new future that's coming. And it's a really exciting new future that's coming. There's a lot of good things that are already happening. Talking to my sister, Sue, out there in California, is noticing that she sees kids playing outside again like they used to when we were kids out in the neighborhood. And I think that's a good thing. So lots of good things coming, but of course it's going to chance favors the prepared, by which I mean, I love this Ben Franklin quote, by failing to prepare, you're preparing to fail. Yeah, so there are a lot of people out there who are preparing to fail right now because they're failing to prepare for this brand new future that's here, that's coming, lots of changes, and not really getting themselves mentally, physically, emotionally ready for that. So before I dive into that topic a little bit more fully, let me go right to the numbers. I'm using yesterday's numbers because I recorded this so early in the day that this was just a bunch of holes in it. So looking at yesterday, because I really wanted to pop one thing out here, for the United States, it's 677,570 total cases that have now been confirmed by one method or another. And seeing this death count of over 2,000 in relation to this relatively low total serious or critical. And by the way, it's only out of the critical itself, out of that category bucket, that you would see people actually succumbing, because the serious, although it's serious, people tend to have a very high survival rate around that. But once you go critical, pretty bad in terms of survival and all of that. So total deaths now at 34,000, and it's just staggering. Italy coming in here with 22,000. Real surprise here, seeing France just absolutely explode. Remember, it was a few weeks ago I noted that they were having trouble culturally adjusting to this, and so they were having trouble with dialing back their cultural practices of being gregarious, kissing on the cheeks, of all of that stuff. And so now, a couple weeks later, it's showing up in their official numbers. And of course, that should be the ominous foreshadowing for all those people who are now actively clamoring for getting back to work, lifting the lockdowns, getting back to life, all of that. I get that. You can do that, but you got to be smart about it, because if you do it not smart, you just end up with a new explosion of cases. And by the way, we're seeing Singapore come on board with a lot of new cases as they come forward. Switzerland really managing to somehow bite down on this and really limit the number of new cases there. China, hey, I'm sure you all saw that in Wuhan, they upped their death count there by 50%. How's that? Opening bid, 50%. I think that's good. It's a good opening bid. I counter with maybe they should increase them by 6,850%. So, let's go there. And I'm not willing to budge off my offer either. So at any rate, yes, lots of new cases still happening. The places that are getting their hands on it and seeing fewer and fewer cases are those places that are managing to wear masks, increase social distancing, and do all of that. So here's one way to look at it. The global doubling time now is 12 days, and it took us 71 days to get to 1 million cases here on April 2nd. 12 more days later, on April 14th, cases had doubled to over 2 million. So first million, the entire length of this, whenever it started. I just dated this from January 22nd because that's where this chart started from, but I believe the first million actually probably took us from at least that part, maybe that far back in November, right? January, December, November. So we could add another 60 days on there. See, if you're more comfortable, think 130 days right here instead of 71. But this is confirmed, only 12 days for that next million. We're going to ask the question, how many days for the next million? And it might probably be less than that, we'd expect, unless we've really managed to flatten the curves. So I noted this day before yesterday, I guess, which was this curious case of the declining death rate that then went back up again. But this is the outcome of total closed cases. Remember, there's a number of ways to measure the case fatality rate. This is simply measuring closed cases. So this doesn't include in either the numerator or the denominator the number of people out there who have the disease who are neither dead or recovered. So this is recovery rate versus death rate, but still kind of an odd thing to see it climbing up like that. A lot of you emailed me with plenty of suggestions and got me through Twitter, and I've sifted through all of them, and I don't really know what to make of it yet, so I'm going to throw you just a little bit more curiosity and see if we can hone in on this. So I'm asking for the brain trust here listening to see if we can figure this out, because I don't think we've quite got there yet, even with all the great suggestions we got. So let's notice here, this is hat tip to Chuck Curran. He sent this piece out that we looked at a couple of days ago, which looked at deaths divided by cases. So that's the total number of deaths here by confirmed cases. So this is being divided by that number on each row. So if we went to the bottom, we would say 34,617 divided by 677,570 gives you 5.1%. And isn't this curious? We see these cases just ticking up, and that's kind of odd. So I was thinking about this, and one of the suggestions that came back was to look at this in relation to the lag. So there's a lag involved. So you might get confirmed here on the 19th, but you might not expire some number of days out into the future. So when you're a confirmed case, quite often what that means is you've shown up at a hospital. Listen, it's still hard to get tested in the United States. So to get tested, to get on this confirmed cases list, pretty typically you had to show up and have pretty severe symptoms. I even know cases of doctors working in proximity to COVID patients with all the symptoms not getting tested because they weren't serious or critical enough yet. So what happens by the time you are serious or critical enough to get tested for this thing? Well, there's a lag still between that serious criticality moment and when you expire. So what happens if we start offsetting these numbers by a certain amount of lag? All right. First thing I did is I gave it a 12-day offset. So this number of deaths here, 4,064, we're going to tick back 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 days back here and divide it by that number of cases. And look, we start at 29.3%, and then 26, and then 25, and then 21, 19, 17, 15.9. And we see this just falling. So it's having the opposite effect of these two numbers. So now I realize, okay, we're honing in. And so this is like a 0-day offset. And this is a 12-day offset. This is climbing. This is falling. So somewhere between those two numbers, there might be a stable number. And I think I got pretty close to it here with a 7-day offset. With a 7-day offset, so we're taking this number here, 1,296 deaths, counting back 1, 2, 3, 4, 5, 6, 7, dividing by those confirmed cases. And we start with 9.3, then 8.7, 9.1, 7.7, 7.1, 7.4, down into the 6s, 6.8, 6.5, back up to 7.4, 7.4, 7.4. Pretty stable. This was the most stable whole number I could find. And I didn't hunt around for partial numbers like 6.5 or stuff like that because it'd be a messier formula. So at any rate, this to me suggests that the correct offset here, because this is a stable number, it's not really falling or climbing. It starts at 7.7 here after it stabilizes after those first few days and basically ends here at 7.4. So close enough for government work and what we're up to here in this free YouTube channel. Worth every penny. You get what you pay for. All right, so if that's the case, then it means to me that the true case fatality rate, once you've been serious enough to show up on this list, is going to actually be closer to 7.4%, and that 7 days is a useful offset because it gives us stability in this overall number. We are neither declining nor advancing. And so if we ran this out long enough, both of these numbers would end up converging around this one if this is the correct theory. Makes sense. Seems logical. And it, of course, very much this idea of having a 7.4% case fatality rate would be something that's absolute. And this is for the United States. These are just United States numbers. I didn't run the same analysis for other regions, for other countries, or the whole world. And for the United States, you have to understand that in this country, my country, we're dealing with a lot of underlying comorbidities that we know are very much unfavorable for this particular honey badger virus, we've got a lot of hypertension, we've got obesity, we've got congestive heart failure, ischemic heart disease, all kinds of underlying comorbidities that turn out to be very much on the list of things that will lead to a very bad outcome, if not death, when you get infected with the honey badger virus. Looking at this on a global rate, here's a bunch of numbers. Hat tip to Stefan. And I'm not using Stefan's last name because he didn't say I could. If you send me something and you don't mind, people are usually pretty good about saying, don't use my name or keep me anonymous, or you can use my first name. But if you want me to use your whole name and you send me something, got to tell me that, because I always default to the side of privacy and confidentiality whenever possible. Not whenever possible, in every case. All right, let's look at what's here. This is pretty interesting. So this is looking at the global rate of deaths versus cases, and we see that's climbing here as well. And I just thought it was interesting to see what it was climbing towards, because here you can see we're getting close to that 7% number. So what's being done here is looking at deaths versus cases. Just these two set against each other. And again, I didn't run an offset on these or a 7-day to see what actually comes out of this. But again, as the world is measuring cases and as the deaths are being recorded, whether those are over-recorded because anybody that dies is just inappropriately tagged with COVID, or in the case we just heard about from the UK, they are not recording lots of deaths, particularly of people in retirement homes, nursing homes, old folks' homes who are dying. They are not being recorded as COVID deaths. One second. Excuse me. Tickle in the throat. Nothing more than that. So whether the deaths are being overreported or underreported, whether the cases are how badly they're underscored and reported because of lack of testing, we don't know any of that yet. But it is interesting to see that over time, these numbers are actually climbing on a global basis. And it's interesting to me that they may be settling out possibly around this same 7.4% number. So we're going to start keeping track of these numbers on that. All right. We're going to go here this is a new edition we're going to start doing called Cracking Under the Strain. This is the Dr. Phil edition. Let's listen in.
250 people a year die from poverty. And the poverty line is getting such that more and more people are going to fall below that because the economy is crashing around us. And they're doing that because people are dying from the coronavirus. I get that. But look, the fact of the matter is we have people dying. 45,000 people a year die from automobile accidents, 480,000 from cigarettes, 360,000 a year from swimming pools, but we don't shut the country down for that. But yet we're doing it for this, and the fall...
Whoa. Back up. Let's listen to that again.
360,000 a year from swimming pools, but we don't.
Whoop, back up.
360,000 a year from swimming pools, but we don't shut the country down for that. But yet we're doing it for this, and the fallout is going to last for years because people's lives are being destroyed.
Okay. So Dr. Phil, and I'm not clear that he actually holds any sort of board certification in anything. I don't either. Not saying that's a big knock necessarily, but I'm not sure what his credentials really here are to be weighing in on this issue so authoritatively. But he did say 360,000 people died in pools. I'm like, well, that is crazy. We got to build better pools. Maybe we should only be allowed to have 6-inch deep pools. Fact check that. Actually, 3,536 were in an average of 3,536 unintentional drownings, non-boat related annually. That's from all sources. That includes pools, but also includes rivers and standing too close to the ocean on the big rock when that rogue wave comes in during a storm. That includes all sorts of things. So, that's that. So he was way off on that number and probably just misspoke, but 360,000 is absolutely not the case. But you know what? This is really a very, very ignorant set of statements he made. Because why? Well, because you can't compare the number of deaths of COVID to car accidents, because car accident deaths don't proceed as an exponential chain reaction that blows up on you because you decided to open a roadway again, right? So let's put this all in context. One of these things is not like the other. So if you want to compare, these are car crashes here in this black flat line. That's what they tend to look like in new weekly deaths. Here was this 2017-18 flu season. This is flu and pneumonia, so who knows what all that other pneumonia is. This is the Asian flu with pneumonia. That was pretty bad. Had a couple of peaks, had this earlier peak and then a later fall peak, but there's the COVID. There it is. Look at that thing. And it's just taken off like crazy. This is recorded in deaths per million and by week. So the New Atlantis, this is a great chart that they threw up here. So this heart disease and cancer, big killers in the United States, and COVID is now just about ready to become more deadly than either of those two things. So it is a big thing, but again, you can't compare something that grows exponentially with something that's a fairly linear, flat thing. It's an inappropriate comparison to make, but I get it. Dr. Phil is cracking under the strain, and he's right. People's lives are getting destroyed. And, of course, the earlier we could have gotten on this as a country, the more we could have gone about it in a way of not disrupting people's lives as much as possible. But, of course, every moment matters when you're facing an exponential foe like the honey badger virus. So every day counts, literally every day. So you can't even waste a week. But if you happen to fritter away a month and a half, well, that's too bad. Now you got to deal with the consequences of that. We've got cracking the Oregon edition, so we got a lot of, they call them right-wing protesters, and I'm not sure why it all necessarily is right-wing. I'm not sure if that's a correct characterization or not, but media is running with that, the idea that there are people in Oregon who are planning Reopen America rallies at state capitals in Oregon and Washington. So possibly right-wing, don't know about that per se, but we got cracking the Michigan edition, and I don't think they've characterized these people as right-wing, but at any rate, nope, the public chafes at stifling restrictions, and this is at the Capitol, outside Michigan governors stay at outside the state capitol in downtown Lansing, Michigan. But what can we notice here is, let's see, nope, no mask on that person, no mask there, nope. I can't find a single mask here, not one mask. And all these people are clustered together. What are the chances that somebody got ill and will die at a gathering that size? Not 100%, but it's certainly way above zero. And there's a darn good chance somebody caught the COVID at this thing. But again, the idea that these people are clamoring at restricting, lifting the stifling restrictions, but don't bother to show up with masks. You know what? How this would have been an effective protest is if everybody showed up, displayed proper social distancing, had masks on, and said, listen, we can handle this. We're responsible. Lift the restrictions. We're not dummies. We can manage this. But when they show up like this, they actually prove that they do need the stifling restrictions because they're showing up like they're dummies. That's just, come on, dummies. If you don't undermine your own point. That's just dumb. All right, but what happens if you do it right? Well, then you get to do it like the Czech Republic here, okay? And they have managed here to, look at this. They brought their R naught below 1 5 days in a row now. 5 days, 1, 2, 3, 4, 5 days in a row. And then they had 3 days right at 1, but they're now got their R naught below 1. How did they do that? Well, they did it with masks for all. Very proud of what they've done there. Everybody's wearing a mask, and then this is what happens. And so look at this. They had ran a whole bunch of new tests, just 82 new cases of COVID-19. Overall, 166 deaths in the whole country. That's 16 deaths per 1 million population. That's 5 times less than the U.S., 7 times less than Sweden, 24 times less than Belgium. All a bunch of places with dummies who don't want to wear masks or do the social distancing or shut their economies down, depending on which country we're talking about. So masks for all, that's how you do it. It's not hard. How is this that hard? It's just not that hard. That's what you do. And, of course, the gold standard for any pandemic is you want to halt your inbound infections. That's step 1. Just stop. No more new infections coming into town or your city or your state. Then masks for everyone. That's it. Those are the first 2 steps. If you just do those 2 things, you're going to have such a different experience on the curve than if you don't do those 2 things. And so, yeah. At any rate, how is this still not? How do people not know this? Listen, as long as if the idea here is pretty easy, right? We all understand it, but I'm agog and aghast that other people don't get this, including all these people right here. we don't know who's got the COVID. We don't know who's got this honey badger virus. It's got an asymptomatic spread period where people who don't have symptoms are capable of spreading it. Some people might be asymptomatic the entire progression of the disease where they are actively spreading it, never have a fever or cough. Other people are pre-symptomatic, meaning they will get the symptoms later, but are still have active viral infections that they're spreading. So you put a mask on everybody, including the people you can't tell by looking at them, and they don't even know themselves. You put the mask on them, and then what happens? Well, then they don't talk and sneeze and cough giant vertical booger things all over your subways, your railings, and other public places and into the air, right? How hard is that to understand? All right. But remember, it was the U.S. Surgeon General himself who back there in February 29th was saying, stop buying masks. Seriously, people, they are not effective in preventing general public from catching coronavirus. They're not effective in preventing general public from catching coronavirus. Looks like they are effective, right? And of course, we knew that even here. It's the most basic, simple thing. Just look at a picture from 1918 and you'll find out that they seem to be important. All right. There's overt revisionism by the New York Times underway right now and other major media outlets, but I'm going to pick on the New York Times here right now because of just how illogical and inconsistent they're being here. New York Times just today here on April 17th came out and said, big article, with limited, constantly shifting information, the WHO showed an early, consistent determination to treat the new contagion like the threat it would become. Yeah, they say the World Health Organization, always cautious, acted more forcefully and faster than many national governments. But President Trump, oh, there it is. This is really an anti-Trump screed. I am apolitical. I'm absolutely apolitical. I don't have people on the left think that I'm horrible for not denouncing Trump, and people on the right think I'm horrible for not promoting Trump. I don't do anything. I don't do left, right. I do up, down. Either you are logical and rational and you can defend your position with facts and with a deep body of knowledge, or you can't, right? That's my axis. And you find people who can do that on both the right and the left. You can find people who can't do that on both the right and the left. So I don't do left, right. I do up, down. At any rate, and if I had to, if you forced me, I'd say a pox on both houses right now because they're both taken over by dummies on both sides of the aisle. So I want to point out this overt revisionism because remember, this was me on January 24th using the WHO's own pandemic checklist from one of their own pandemic documents saying that as of January 24th that we had ding, checked off phase 1, ding, checked off phase 2, ding, checked off phase 3, ding, and we had checked off phase 4 because that's where we were at the point on January 24th, but we rapidly, within a week, had made it to ding, checked 5. So by the first week of February, actually it was right around February 1st, we'd already made it through all 5 phases, which means we were in a full-blown pandemic, according to the WHO. So when did the WHO actually declare a pandemic? March 11th. Remember, every day counts. This is also the New York Times pointing out very helpfully in an article that came out not that long ago that this is the science behind what happens if you avert one case now versus what happens if you avert one case in 7 days. Well, if you avert one case now, you avoid over 2,200 cases. And if you avert that one case in 7 days, you only avert maybe 600 cases. That's the power of just waiting 1 week. So once again, how many weeks is it between January 24th and March 11th? Let's see, that would be 4 or 5. It's about 6 weeks. 6 to 7 weeks. So the New York Times is here saying, well, the WHO did the best they possibly could with shifting information. Like, no, this is their own checklist. This is their own checklist. You don't get to rewrite history like that. And because of that, it wasn't like the WHO was late a day or 2 days. And by the way, New York Times, you know this, right? Every day matters. They were late by 6 to 7 weeks on this whole thing. Maybe longer. I would submit to you that they should have known even before I did because they had access to better data and all that. So I have openly called for defunding the World Health Organization. Why? Because I happen to believe that incentives matter. I happen to believe the consequences aren't just for little people and the poor, right? Oh, you jaywalked, here's a citation for hundreds of dollars you can't afford. Oh, can't afford that? You got to go to jail. All of that. I believe that incentives work at all levels because humans are humans. And I believe in the power of incentives. In fact, Charlie Munger is the right-hand man of Warren Buffett. He has a quote that I just love. He said, "Show me the incentive and I will show you the outcome." Thank you, Charlie. That is a perfect statement. You show me the incentive, I will show you the outcome. So I believe that the incentive ought to be defund the WHO. Make it painful. Make them have to fire a bunch of their senior staff who botched this whole thing. Get rid of them. And then the next batch of leaders who come into that organization, they're going to behave a little bit differently. But if you don't have a consequence for the WHO declaring a coronavirus pandemic on March 11th, if there's no consequence for that, then you'll continue to have a defective organization who will continue to botch things and behave badly. Why? Because there's no difference between how you train a dog, how you raise a child, and how you scold an organization in this particular case. It's always the same because humans are humans, animals are animals. We all behave to incentives, right? Show me the incentive, I'll show you the outcome. Well, time to defund the WHO, knock them back a little bit, make them lick their wounds, think that through, and think, you know what? I should behave better in the future because that's how the world works. All right, let's check in with the U.S. Treasury Secretary. Here's a very important statement for Americans.
These checks in the mail or direct deposit, it's really bridge liquidity for people as they go through these difficult times.
Bridge liquidity for about 8 weeks?
Well, I think the entire package provides economic relief overall for about 10 weeks. These checks.
All right, whoever did this, you made my day. You evil genius. Treasury Secretary Cruella de Vil explains how Americans can live comfortably on $1,200 a month for 10 weeks. And I know. He didn't exactly say that. He said that the entire benefits package. But honestly, that's if you're fired, you're picking up an extra $600 a week in unemployment benefits. So I would love to see Treasury Secretary Steve Mnuchin and his wife get by on $1,200 for 10 weeks. That'd be a great reality TV show. I would watch that. $1,200. Let's see how they do. All right, but this is really it's really that grotesque, and I'm making fun of it because what else can you do? It's really that sad that we have so-called leaders saying they think $1,200 is sufficient. As well, this is really also a let them eat cake moment because here we're noticing two things have been put into a single chart here. The first would be the initial claims, right? And so here's jobless claims. We had 3.3 million, then 6.9, then 6.6, and we just had 5.2 million new initial jobless claims that came through for last week. But and there was much cheering, like, oh yeah, look, the pace is slowing down. Dude, that was Easter. There were people couldn't even file them on Friday. So this is comparing a 5-day week, a 5-day week, and a 4-day week. And there was much cheering in the press saying it's good news. At least the pace of claims is slowed down. Here's a prediction: it's going to speed back up again next week as that Friday piles in to next week's claims. But don't worry, the press will be sure to point that out to you that that includes an extra day from this week, even though they didn't point out that this week had a 1 day shortened. So that's 22 million jobless claims. And against that, we have 255 S&P points. Look at these gains. And the S&P's up another 50, 60 points as I'm typing this out right now, recording this. Huge gains. Yay. 3.3 million people lost their jobs. More gains. Why is this doing this? And a lot of people have written me, and I've seen a lot of confusion. I'll tell you why this is happening. This is happening because the Federal Reserve is printing money and throwing it into the stock market. Not directly. They have to go through an intermediary, but it's happening. And they're just printing money and throwing it into financial assets because to them, the most important thing is that the financial assets of the very, very wealthy are preserved. That's it. That's the whole system is about preserving financial assets for the top 1%. So this isn't really a plan at all. It's just pure habit. Here's what they do. So here's the S&P. I just took a screenshot a little while ago. Up 1.84%. We got, up 51 points. You got the Dow up 490. You got gold smacked. You can't buy any, by the way, if you're at the retail level. Very, very hard to get your hands on any gold. Huge shortages. The mint's closed down. Mines are closed. You can't actually buy any, but it's $35 cheaper an ounce, Chris. But you can't get any at that price. That means it's not a market. You know what a market is? A market is if there's no product for sale, the price rises until some product comes magically out into the marketplace. That is what a marketplace is. Supply and demand. Price is match supply and demand. There's a relationship there. So they keep setting and rigging this fictitious price for gold and smacking it down and propping stocks. Why? Pure habit. This is what they've been doing for more than a decade to try and signal to everybody all is well. Rising stocks says, yay, we must be getting better. There's hope. There's cures on the horizon for COVID. Gold is getting smacked down. That means that people trust our national managers. They feel good about them. Do they? Or is this just a rigged gold price? Truth is, it's actually rigged, and there's a whole story behind it, and I could show you all the data. It's completely rigged. It's fraudulent. Here's the true story. Rising stocks and the price of oil shellacked for another 8% loss. Unbelievable. Just absolute carnage. This is fake. This is real. This is real. And I would invite you to take your cues from the real stuff. I like how Michael Every of Rabobank put it here. He says, I have written about economics and markets for over 20 years and try and often fail to detach myself from some of the wilder, more unusual, or more illogical and or unsustainable movements one sees. However, U.S. equities rallying for a fourth successive week on the back of a fourth successive print showing millions of U.S. citizens losing their jobs is a real splinter in the mind's eye. Maybe if everyone loses their job, equities could double? Yeah, well said, Michael. It's not just a splinter in mind's eye. It's actually an insulting stick in up everybody's backside, because the rallying of the stocks has nothing to do with the actual conditions on the ground. This is just the Federal Reserve pumping this markets up so that everybody can feel better about things. It's literally nothing. It's that sad. That's where we're at. As well, what else, Michael? It's not just this massive prints showing millions of people out of work. That's true, but we're seeing things like here, the leading economic indicators. This is across many years. If this is too small to read, this starts in 1960 to 64, that 5-year window. Here's the print. It's not just less than anything we've seen before. It blows away the depths of the great financial crisis, the really bad double dip recession, and the first burst down in 1980 there. It just eclipses everything. It's the worst thing you could possibly imagine. And not only are stocks rising into this, but the NASDAQ is actually green on the year, which is absolutely not even just nonsensical, but it tells you the degree and the depths of desperation. But I'll tell you what, it's not actually a plan. I know. This is all they know how to do. Jam stocks, sell gold. It's really tired sort of a thing that they do, but it's pure habit. And they actually don't know what else to do. They are so out of ideas. Their whole set of ideas is boiled down to, let's just make stocks go up and we'll make gold go down, and then people will feel better about us and the future, right? So it's really that. It's really that shallow. I wish there was more to it than that, but there really isn't. Oh, there's one other thing. They and their friends get stinking rich as they harvest money out of the system while they're jamming it. That's always happening. But remember, I need you to plant a garden because there's tough times coming, and having a garden is going to be an important part of your future. And as well, I should mention you should also have water. Figure out how your water storage is going to go. Many of you emailed me around that. I thank you very much. So if you can collect rainwater, that would be something you could do. Or think about ways to get access to water. But having a good water filter is a really important thing, because I have a Berkey water filter invented in India to combat the viral diseases and the parasitic diseases that transmitted through the water, such things as cholera, yellow fever, things like that. And it was invented way back in the 1800s. It's just a simple gravity feed water filter. You pour water in the top. There's a couple of filter cones up there, 2 to 4 of them. And then water drips down into a lower catchment thing at the bottom. And by the way, it will filter out all viruses, all bacteria. You could pour dirty water from the end of your driveway through this thing, and it comes out clear as can be at the bottom. So that's a solution, especially for people who don't have access to running water, a well of their own, other things like that. So maybe a water filter too. So plant a garden, get some water, just the basics. Remember, I need you to resubscribe if necessary to every one of my outlet channels. Booty here wrote just today from Singapore, I too was unfollowed. Well, at Jack, let idiots like Mitchell have a blue check mark and then men like Chris be silenced. Great job, @Jack. That's Jack, @Jack, the CEO of Twitter. I hope the COVID dead who listened to Bill Mitchell haunt and curse you forever. YouTube, unsubscribe me too. And tagging somebody there from YouTube. So at any rate, yeah, people continue to get unsubscribed from this channel. Why? Because I take no prisoners. If you're doing a crappy job, I will tell you that. I'll tell that to The Who. I'll tell that to the New York Times. I'm not deferential enough. I don't, make apologies. If you're doing a bad job, I'm going to call you out on it and, pick up when people, thank you, Paul, for making this, just Cruella, brilliant job. I feel like watching that again, but at any rate, I won't put us through that. But, if leaders are doing a bad job, I'm going to call them out on it. Okay. Conclusions for today. The strain is really beginning to show in the United States, and I think populations all over the place are going to begin to come out of the woodwork and ignore government edicts to stay inside and social distancing and all that. Then we'll see what happens next. There's obviously a lot of chance for conflict in that. And of course, an even better chance that the honey badger virus will escape the pen and come roaring back out again into a variety of communities that don't quite get it. They will, but the next couple of waves could be painful. U.S. population, I believe, is poorly prepared for either staying in lockdown, can't manage it, or getting back to work. Because they can't even think about social distancing in mass, apparently. I mean, that's just really, if you can't do either of those things, I don't know what to tell you. By the way, masks work. Here in the U.S., we can't even seem to get that simple part right. I mean, how hard is that? Just come on. Just wear the mask. All right. The efforts to rehabilitate the image of the Who they're just laughably bad right now. They're really indefensible. They're illogical. Probably political more than anything else. So, please ignore all those attempts to say that, that you might be reading about that the Who did the best any organization could given the hard, information that they had and that China was lying. Didn't fool me, and I'm not paid to do this particular job. So at any rate, let's not reward bad behaviors. Come on. Show me the incentive, I'll show you the outcome. The Who did very, very terribly. They should suffer some consequences. Therefore, they will have an incentive to not be so terrible in the future. That's how it works. The propping of stocks and all that stuff and the selling of gold, they're really the only tried and true signaling mechanisms of the keepers of the faith. We sometimes call them the central banks, like the Federal Reserve and things like that. But what they're really trying to do is signal to everybody that all is well. Please keep borrowing. Please keep buying stuff. Please keep shopping. Keep doing all of that stuff, right? But I want you to consider not listening to this stock propping and all that other stuff, that actually true wealth, primary wealth and secondary wealth. True wealth is good soil, clean water, access to food, safety, security, your family's safety and security, having your loved ones around you. That's true wealth. Stocks and all that junk are just signaling mechanisms designed to get you to go out and spend more. All right. That's all I got for today, and I have to work in my garden this weekend, so I'm probably going to take the whole weekend off here again and get out there and dig beds. I got my onions in yesterday. I got to get the potatoes in next, and I really have to get a lot of work done out there. So that's what my weekend looks like. I want you to have a great weekend on your end, and remember, do what you can to make yourself and your loved ones safe going into the future, and through it all, the most important thing to remember is that it's time to plan and prepare. So please, let's flip this around. By preparing, you are managing to not fail. So let's prepare, everyone, and have a great weekend. We'll talk to you later. Bye-bye.
Hi, folks. Adam Taggart here. Chris Martinson and I are the co-founders of Peak Prosperity. If you want to get alerted whenever we release a new video from Chris, just click the red subscribe button right beneath the YouTube video player. Once you've done that, a little bell icon will appear right next to it. Click on that bell. It looks like this. And that's it. The next time we publish a video from Chris, you'll immediately receive a notification from YouTube. Thanks for watching our videos.